Good afternoon, everyone, and thank you for joining us. I am Mark Meaden, Executive Vice President of UJ Federation of New York. Since February 24th, 2022, the war in Ukraine has been covered from every angle, military, political, and humanitarian. But one of the most complex and least visible aspects of the crisis is what is happening deep inside the healthcare system. The human cost of the war continues to rise every day. Thousands have been killed and tens of thousands have been injured. Millions remain displaced, and critical infrastructure, including hospitals, power systems, and supply chains, have been repeatedly disrupted. Before the war, Ukraine had a very well-developed and sophisticated healthcare system. Today, that system is under very significant strain. What does it mean to deliver care in a country under constant threat? What happens to patients with chronic illness? What happens to hospitals? What happens to the healthcare providers working in the hospitals? What happens to the systems that hold it together? Those are the issues we're going to seek to cover today. At UJ Federation, we've been deeply engaged in this work with partners on the ground since the earliest days of the war, and we're very proud that AFIA has been one of our leading partners. I personally have had the privilege to travel 3 times to Poland to meet the Ukrainian refugees as they cross the border and to see the significant work being supported by UJA, by AFIA, and by many other organizations in the Jewish and Israeli communities. What we've learned is that this crisis is not static. It is evolving and growing every day and growing more complex. Today, we'll have an opportunity to hear directly from those living and working inside that reality. We will hear from 3 extraordinary speakers who are senior leaders and practitioners in the Ukrainian healthcare system. They're all calling in from the Ukraine, where it's now early evening, so we thank you for being here with us. Before I introduce our Ukrainian panelists, I want to take a moment to introduce Danielle Butin, who's based in New York, is the founder and CEO of AFIA, and one of the most important players in the global today. Danielle, thank you for joining us, and thank you for all the incredible work that AFIA does supporting people in need around the world. Our first panelist today is Dr. Olga Oleksik, who's joining us from Uzhhorod in Western Ukraine. Dr. Olga is an endocrinologist, a health policy expert, a public health advocate, and a member of the regional parliament. Our next colleague will be Halina Skipalska, who's joining us from Kyiv. Halina is the executive director of the Ukrainian Foundation for Public Health and the country director of Health Right International in the Ukraine. And finally, Dr. Svetlana Yaremchuk, who's joining us from Kyiv as well. Dr. Svetlana is a board member of the Israel Medical Mission in Ukraine, amongst numerous other critical roles that she plays in society. Thank you all for being with us today. Danielle, let me start with you. AFIA has been a partner to UJ Federation in our disaster relief work around the world in numerous crisis zones, but especially in Ukraine over the last 4 years. Can you briefly introduce AFIA's mission? How and why did AFIA become involved in Ukraine? And what has it meant for you to do the work that you and AFIA are doing in Ukraine today?
Okay. First of all, thank you, Mark, my dear friend. It is an honor to be on this panel with you and these remarkable, visionary, and resilient colleagues in Ukraine. So, AFIA's mission. What AFIA does is we improve health outcomes by rescuing surplus medical supplies and matching these supplies to compromised and under-resourced health systems locally and globally. So, in addition to steadily strengthening health systems, we also monitor crises around the world, both man made disasters and climate related emergencies. And where healthcare access and delivery are impacted, we respond. And here, Ukraine was no exception. Our connection there did not start, though, when the war began. It started years earlier. A remarkable volunteer, a woman from
Woman from
Ukraine, Valentina, was already bringing bags of our supplies home to the front line of occupied regions. In early 2022, she introduced us to the medical director in the largest hospital in Kyiv. And when tanks started rolling in, he called and asked us for as many amputation kits as we could possibly assemble. He knew what was coming, and Afia acted. And that's what we do. We have the backs of those we deliver to, and they know they can turn to us. Just as communities here find their way to AFIA to help, our partners on the ground know we are going to show up for them. So, what does this mean for the bigger, broader community? The strength is always in community. Thousands have made AFIA their home for responding to this crisis, and the community that rallied around Ukraine through us is an extraordinary one. Financial donors across the nation chose AFIA as their vehicle for impact. Hospitals donated product to us and asked steadily what is needed, and they continue to support healthcare in Ukraine. At the beginning of this war, HSS surgeons on a large screen in a conference room in New York City walked with us via FaceTime through instrument bins that we have in the warehouse. And together they identified all of the orthopedic trauma related surgical tools that we needed to pack immediately. Greater New York Hospital Association and the amazing Lee Pearlman were our champion in helping to get the entire network of hospitals in New York on board. UJA, a deep partner of ours for years, helped to sponsor the work, but also opened up hundreds of sorts for the community to come and help us to sort through these supplies. The corporate partners also played a huge role in this. Regeneron, MasterCard, Bain, Bloomberg, Warner Music showed up, collected supplies, donated supplies, and helped us to move these across the sea. And AFIA became an incredible resource for Ukrainian expats in our own community, where they felt like they had a place that they could help home in a very tangible, productive way. And I think the key here is it takes many hands and everyone knows someone. And when this community showed up, we felt it, and so did the 30 plus partners who we were able to help on the ground.
So, Danielle, thank you for that extraordinary overview of the work that AFIA does and your ability to move medical supplies expeditiously to critical parts of the world in great need. I think what would be really important now is to talk about what's the current reality on the ground. And if we were standing inside one of your hospitals or one of your clinics today, anywhere in Ukraine, what would we see? We have some photos that we're going to put up right now from your various locations. And let's just take a moment to let these images sink in before we actually talk about what it is that you're seeing inside your clinics and hospitals. Svetlana, let's begin with you. Take us
Okay.
inside. Let's take us inside your hospital today. What are we seeing? What does it look like? What's the reality on the ground?
You just saw pictures from my hospital. In the mid of January, we was attacked by Russian drones, and now we have big problems with our windows because 80 windows was destroyed, and we have problems inside of our outpatient clinic because outpatient clinic was partially destroyed too. And we have a lot now. We have a lot of soldiers. Our main patients are soldiers. These soldiers suffering from different pathology of ENT organs. Biggest part of them suffering after blast wave injury. And we have much more patient, much more than in previous time. And we have a lot of problems with this patient because we don't have protocol for treatment patient with blast wave trauma, with contusion, and a lot of these patients suffering from post-traumatic syndrome. And it's a big power for our doctors because we need a special communication with these poor soldiers. And unfortunately, we have very old equipment, and due to a big quantity of patient, we have very old and equipment, and our instruments for surgical interventions are very old, and part of them really broke.
Svetlana, can I just
It's our reality.
take you back to where you began? You said your hospital was attacked by Russian drones. Were you at the hospital during that attack? And what does it feel like
It was
when
at
medical
nighttime. It was at
nighttime?
nighttime. Usually Russians bombing us in nighttime. Unfortunately, we don't have normal sleep, but in this time was injured and destroyed our outpatient clinic, and at this time this building was empty. It's
And did you
only damage of equipment and offices inside, but fortunately, all patients are safe.
and do you believe it was a conscious and strategic decision to attack a hospital in order to do this kind of damage to the medical system?
We have a lot of damaged hospital in Ukraine. All of you heard about damage of Ahmadet. It's a big children's hospital, and in Kiev we have, I think, at least 5 damages hospital. And our government in Kiev covered our expenses for windows and sometimes for restoration jobs, but no for buying new equipment because we don't have money for this one.
Dr. Olga, you're in Western Ukraine, very close to the border, to the Western border. How has your hospital been affected? What is it like inside your hospital today?
Thank you. Next time. When we looked for our hospital, my own hospital is Zakarpattia Regional Hospital in Uzhgorod. So it's one of the largest hospital which with very long history, more than 150 years was founded. So, but unfortunately, it's not a modern hospital. Hospital need to fixing, but war started, and we have not enough time to fixing, and we have not a modern hospital because this hospital is stay in center of the city, but our region is a safe region, and this is the reason why a lot of patients with trauma, it's a military patient from eastern part of Ukraine, from other hospital, from Dnipro, from Kharkiv, come to us, our hospital, to have micro surgeries operation with in our surgery department. So we have department for rehabilitation, and we developed this department for our patient, not just military patient, civil patient also. So, however, what truly defines of our hospital is not just a wall. This is people. So we have very good professional, dedicated doctors and medical teams who provide care every day. Yes, of course, we would like to work in a new modern hospital, but it's not possible in this time. afterwards. Yes, of course, we will have this possibility. But in this time, our hospital work like a full capacity with a mixed type of patient. Chronic patient and military patient, soldiers, our soldiers after injury, after trauma, and a lot of them have a mental problem also, psychology problem, problem with other conditions, and we need multidisciplinary teams for help this patient, but because in every department have the one type of doctors, but not we have not a patient just with one pathology, one disease. We have mixed disease, and this need multidisciplinary teams, doctors, and this is very, very necessary, is very important. So we are develop the rehabilitation department, and we have very good young teams for rehabilitologists who help our soldiers. I sent you for maybe Liz, I sent before our meeting, I sent a few photos from our department of rehabilitology, which was just founded in last year, and this was it's new department, and we just start to develop this medical helps for our patients.
Dr. Olga, I know you have a new rehabilitation department. I know about a month ago you received supplies that were donated by Mount Sinai Hospital to your department. Can you talk about the supplies that you received and the work that AFIA did in helping to get those supplies to you?
Yeah, AFIA sent us rehabilitation equipment, and that was that is working in our rehabilitation department. It's very good for modern for our doctor and for our rehabilitologist, because it's we can help more patients than we can before. So it's very important, because more equipment, more patient we can help.
Right. Halina, can you share from your perspective what's your current reality? And if we walked into one of your clinics or hospitals where you're present, what are we seeing today?
Yes, let me share our observations. And I represent here civil society organizations that also work at primary healthcare facilities in hospitals, because they are entry points for majority of our clients. So you would see a system that continues to function, and this is very important, but under constant and prolonged pressure. Through Health Right International and also Ukrainian Foundation for Public Health, we currently reach people across all regions of Ukraine. Majority of our beneficiaries are really in East and South, over 1.5 million over past 4 years of the full-scale invasion. Our services include mobile teams which operate in frontline areas and are also linked to primary healthcare facilities, safe spaces for women and girls, different integrated units and primary healthcare facilities and hospitals, also mental health centers, halfway houses or shelters for mothers with children, and different types of digital platforms. So we have currently more than 400 professionals, psychologists, social workers, clinicians, nurses, general practitioners as part of our system only. And what you would clearly see is that this is no longer only about humanitarian response, as we apply, and Dr. Olga mentioned it, holistic approach, multidisciplinary approach, which combines psychological support, protection, health services, and also case management. And we help people restore stability, dignity, and also rebuild their lives. At the same time, people come to us not only with immediate needs, but also with accumulated traumas. And this is fifth year of full-scale invasion. This is our reality. And this is result of years of war, year of shelling, bombing, displacement. Still, we have displacement in country, outside of country, people who return, people who come from temporary occupied territories, who come from captivities, and also uncertainty. Uncertainty is one of the biggest challenging realities now, I would say.
So you use the word the system under pressure. I think that's a really good description for us to focus on for a moment. People think about the kinds of issues you've been talking about, but I don't think people think about the infrastructure, what happens behind the scenes. There are water shortages when a water pipe gets hit by a missile. There are power outages all the time when the Russian drones and missiles hit power systems. There are direct attacks on clinics and hospitals, as we heard from some of our colleagues before. There are disruptions in supplies. There are disruptions to infrastructure. There are the challenges of taking care of your own family when there's an attack on your city, and yet you need to be taking care of the patients as well. How do you personally function under that kind of pressure, and how does the system function with that kind of pressure on the system, on the water supplies, the electrical supplies, shortage of medications, lack of equipment when one of your hospitals gets hit and you lose an operating room? How do you maintain focus under that kind of pressure and that kind of stress? Helena, why don't you respond first?
Let me explain that, as I mentioned, system is functioning, but it is stretched and under continuous strain. We are dealing with repeated disruptions, as you mentioned it, and I would mention that this past winter was, I would say, one of the most difficult we have experienced. In one of our offices in Kiev, in central part of Kiev, we had no heating for nearly 2 months, with -15, -20 outside of door. Indoor temperatures in many apartments dropped to around 10, +10, +11 Celsius. Even with a generator, we simply couldn't heat the office premises, because generators can keep light and basic services running, but they cannot replace full heating system. And this reflects the broader situation across the country. According to World Health Organization, up to 70% of energy capacity has been damaged already. 85% of water systems experience regular outages, and 1 of 5 families reports health problems linked to cold indoor temperatures. I know a lot of my staff just was sick for 2 months. Attacks on healthcare have also increased, making the past year one of the most intense since the full-scale invasion. Because I remember 2022 winter, 2023 winter, when I was here, I traveled also a lot to east of Ukraine. So this one winter was coldest and also very hard. And this is reality in which healthcare providers continue to deliver services and patients continue to seek care and come to us. Despite all this, and again, this is largely due to the extraordinary commitment of healthcare professionals, and also strong collaboration between national systems, civil society organizations, and international partners like AFIA Foundation and many other donors. So I would say that this resilience also has limits, to be realistic and honest with you, and it's being tested every day, and it is not sustainable without continued and predictable investment and also support. So personally, yeah, and I mentioned it, personally for me, this winter was the hardest one, and for my staff also. But this is why we are so happy to have this warm weather now outside.
Dr. Svetlana, talk about the pressures on your hospital, water shortages, power outages, lack of equipment. How does that affect your ability to deliver critical medical services to patients in tremendous need?
I completely agree with Halina. This winter was worst in my life, and we don't have heating in our hospital. And from January and February, we have only 4 hours normal electricity per day in hospital, and use electricity from generator. It was humanitarian aid from our partners, and but we should buy gasoline for the generators by own money, because we don't have money from our government, from Kiev government. And we had a big problem with water, and our nurses bring water from the 1st floor to the 7th floor, because our operations rooms located on the 7th floor. And but despite of this bad situation in our country, we take care of our patient. We examine a lot of our patient. We operate our patient. For example, if I start operation before air alarm, I will finish this operation in time of alarm. But if alarm before my patient will be in operation room, I should wait. And how many I should wait, I don't know. It's really very bad influence of our mood, our mood situation at whole. But our doctors, our nurses are very brave and strong people. And I think only due to this very good people, we can take care of our patient. And thank you very much for our foreign colleagues and our partners, which bring some supplies for us, which bring some beds and operation tables and instruments for us, because we get support. And we think in the nearest future, we will have normal life. And due to your support, we can take care of our patients.
Well, clearly the frontline healthcare providers, some of the real heroes and heroines of the past 4 years, but they couldn't do all of their work without Danielle, what you and your colleagues have been supporting them with. Can you take a moment and just share, how do you make decisions on what hospital to support, where to send supplies, what types of supplies are most needed? So walk us through a day in the life of Danielle and the AFIA warehouse.
You mean
there? No, don't. Do you want to add something?
No.
No? Okay. It's complicated, and it is a moving landscape. So in the beginning, we were asked for everything from chest seal bandages to chemical resuscitators. The list spoke volumes around the needs on the ground and what was happening in terms of violence. And that was the primary focus of supplies for a very long time. And interestingly, the need for urgent and acute care has not dissipated, but the list has changed. And so, as Olga referred to earlier, one of the things we're being asked for more and more, because there are so many who are injured and have had traumatic amputations, that we are now focusing on making a difference in rehabilitation medicine, because people who are injured and they are suffering with trauma and the emotional trauma of it, there is a different world available to them if they can get up and they can move again, as opposed to just staying in bed. And so what we are focusing on, and this is really a beautiful full circle, so much of AFIA's durable medical equipment, our hospital beds, our wheelchairs, our walkers, our canes come from the bereaved. The bereaved community in New York donate these supplies to us. We make sure everything is fixed and ready to go, and then it creates a second life for people who without these supplies would not have it. So we helped with this hospital on a rehab angle on the western side of Ukraine. We're working with HealthRight and with IMM on lists that are coming in and doing the best we can to match what they need. So, Mark, it is a moving target. It really depends on who's coming to us with which list and an ability to distribute. And the three partners we have here are exceptional at figuring out what is needed and what can the distribution arm be once these supplies arrive. But we have a path in. We have a proven path in now, that is steady and true.
May I also
Sure.
add
Helena, go ahead.
that every day we receive requests from clinics, from hospitals and doctors asking support. And I'm not even referring to highly specialized mentioned hospitals in west of Ukraine, such as those supporting veterans, where these needs are extremely high. I'm talking also about ordinary healthcare facilities and ordinary people, pregnant women, children, cancer patients, older person. They cannot wait. And these are not isolated cases. This is daily reality across the country. And these are people to whom we helped with support of AFIA Foundation.
Thank you all for sharing the structural challenges that you're facing. Let's make this more personal and talk about the emotions that each of you have to deal with on a daily basis. Olga, if you could think about one story that sticks with you in your mind, a patient you've helped, a family in crisis. There are hundreds, if not thousands, of stories, but is there one that sticks with you that you want to share with our audience today that really gives us an opportunity to understand what it's like for the people of Ukraine today? Dr. Olga, are you with us?
Olga, I think you're on mute.
Yeah.
Perfect.
In our hospital, we have more and more people with trauma, and our hospital organized prosthetic for soldiers with amputation and for amputation legs. And it's very important because in our safe region, it is possible to organize this help very safety. So more and more people with chronic disease come to our region for help for living, and they live eastern part of Ukraine, and they choose our region because we are safe. So we have increase people with oncology with diabetes, because this is chronic disease, but in the situation with stress, this disease is increases. And we have a very big problem with mental problem with psychologists, PTSD problem in men who come after war and they live in family, and it's problem in psychologist problem in family, and very often family broken. So one of example of my life, my husband was in the war, and he come after war. He is veterans, and he fight in Ukraine army 2 years, but after when he come to home, he have very big mental problem. But no, not every psychologist can help him, because it's impossible to say every situation in his brain. So I think that it's very big big problem to help come back from war. The majority soldiers after a big stress, and his help is soldiers like him. This is his friend after army, and he have a team, and he help in this team 1-to-1. Okay, so it's very big problem to help adaptation for after war our soldiers, our people after captivity. I have a friend, my best friend was at the Mariupol and Azovstal. She's woman 52 years old. So she have a big problem, psychologist, and she have a chronic disease, and she must live. She want to live, and she want to have a normally live. But it's very big work to adaptive my Galina to normal live, and it's every day big work and big support from family, from friend, from working team, and from everybody who is in his area. So it's very important that foundation like AFIA support our country, our hospital. I'm thankful for sincerely thankful for AFIA, Daniel, and David, and Liz, and all teams of AFIA Foundation, that you continue support our hospital in Kiev, in Kharkiv, in Uzhgorod. It's very important, and I have very big sincerely thank you for this support.
Dr. Olga, thank you for sharing that. Particularly, thank you for sharing your husband's story. None of us think about our own personal families. How are you doing personally? How are you coping with the stress of these issues, particularly when your husband spent 2 years away from you fighting? How did you wake up in the morning and have the strength to go take care of others in need when you had to worry about your own husband's survival?
I'm not just one woman who wait his husband, who waited with his husband from war. So I am very happy that my husband come back. So I'm very happy. This is firstly. I'm working a lot and more because in my work I have not so much stress. When I'm working, it's this anti-stress for me. So when I'm working for our people, for our soldiers, like volunteers, I have satisfaction and big satisfaction for myself. So this
Dr.
my
Svetlana,
way.
is there one story that comes to mind that you cannot stop thinking about? One story that has moved you, one patient that has really been impactful in your life?
Yeah.
We have, I have a lot of stories and I have a lack of time, but a lot of our doctors lost relatives and lost friends, and I lost my very close friend in this war. It was very hard for me, and my parents spent 3 weeks in occupation, and it's very hard, and I get a bad influence for our mood, but we try work much more than we can, and only in work we can improve because we can see that our help to our soldiers is very fruitful, and we can dramatically improve situation with here of our soldiers, and normal breathing, and improve whole status. And we have big support from our Israel colleague from Ariel University, and we organize some courses with psychiatrists which have dealt with soldiers before and get big experience, but now we're much more experienced than Israel colleagues, and we can organize workshop with our colleagues. But work with soldiers, it's not very easy, because due to constant war situation and lack of sleep, a lot of kills everywhere, and they're very aggressive and need a special way for communication with them. And we try to do my best for this communication, but sometimes we need some relaxation for my colleagues, and organize some meetings and workshops for decrease stress in this category in my colleagues. And we have good cooperation with UMS, it's European Doctor Society, and with Mark Hermans, he is a very famous psychiatric specialist, and sometimes he organizes some relaxed courses for doctors. It's very important for us.
Helena, any specific story that comes to mind for you that's been really impactful in your own personal story over the past 4 years?
I also have a lot of such stories every day. And just to add that for people, this crisis is deeply personal and long-term. I would add that because we are working with IDPs in East and South, so families are separated for years. Some many members are at the front, others abroad. Many people live under constant threat. And at the same time, people in frontline areas do not leave these territories, not because they feel safe, but because they simply have nowhere else to go. And we see children with an anxiety every day, I would mention about children and also behavioral challenges and women who require long-term support after experiencing violence, for example. And now I remember displaced women with children who received hygienic kits throughout support we provided. And for them, this was very simple, but I met them when I visited with mobile teams one of IDP camps in east of Ukraine. But for them, this was not only about basic items. It also reduced daily stress and allowed the mother to focus on caring for her children and rebuilding a sense of normality. And this is what the crisis look like. Invisible trauma, chronic stress, and also long-term disruption of life.
Danielle, anything you want to add to that?
One of the stories that I think will always stay with me was a ex-Navy SEAL who had retired from the service, wanted to go to the front line and train medics with how to deliver care and how to respond to urgent medical needs and literally which cars work best in that environment. And he came to us and we packed him with a significant volume of supplies so he could train and then he could share. And the one thing he asked us for was he said, I need tampons and baby diapers. And the tampons were for bullet holes, and the baby diapers were for the compression of the wound. And him coming to AFIA and asking for those supplies is a story that will stay, I think, with all of us. And we all just sat there with tears in our eyes welling up, and this was on his packing list. So I think I'm so deeply moved by these three extraordinary women on this, and I think one of the pieces that we all believe in is that action is the antidote to trauma. The more we act, the more we help, the more we do, the more we can find peace in ourselves in this very challenging circumstance.
So can we just pick up on a comment that Helena made about the children? For any of the three of you, just share your impressions. What's the impact on children in Ukrainian society, the depression, PTSD, other mental conditions that they're going to face? And how can the society long term ensure that these kids get the support they need to grow up and be healthy, productive members of society after having lived through 4 years of air raid sirens and bombings and fathers and uncles and brothers going off to war, many not coming home? Any sense for how we struggle with that question on the impact on children?
Yes, children, I just start maybe that children are affected a lot. And actually, I again would emphasize women and children. They are facing multiple layers of vulnerability. Again, displacement, which continue. According to OCHA, recent Ukraine humanitarian country plan for this 2026, we have around 14.6 million people which remain in need of humanitarian assistance, and majority are women and children. So humanitarian impact needs are huge, but also violence, because this higher level of aggression everywhere in society also influence, unfortunately, families who are in crisis. Loss of income, also a lot of families feel this now, particularly in fifth year of full-scale invasion, and also this prolonged uncertainty. People cannot plan future at all. They do not understand how to build future, what will be next. And these needs are no longer short-term. They require also long-term psychological, social, and economic support. This is why in our, for example, resilience centers, mental health centers, we have increased number of requests from mothers with children. Children need psychological support, psychiatric consultations, and even treatment. So this war unfortunately influenced our children a lot.
Svetlana, you're a board member of the Israel Medical Mission in Ukraine. Can you talk for a few minutes about partnership with colleagues in Israel, what the Israeli doctors are doing on the ground, and the role they're playing in supporting you and the people of the Ukraine?
Our Israel colleague from Nathan Voluntary Mission share with us our experience in wartime. It was in the first years of Russian invasion in Ukraine, and they send us a lot of material, books about psychiatric support for veterans and for soldiers. And Ariel University organized together, we organized together with Ariel University a lot of workshop in for different areas of medicine, not only in the psychiatric area, in otolaryngology area, dermatology area. We have a lot of support in rehabilitation. A person which lost legs, foot, and it's really new for us. And now we organize a lot of meetings together with our Israel colleagues, and this is very good for us, and they bring a lot of new things for us.
Helena,
just a moment. And
Go
we
ahead.
organized telemedicine. We can consultate our patient with different pathology, with very strong different pathology in Israel due to telemedicine possibilities.
That's terrific. Really exciting to hear that. Helena, what do you see as the biggest gap in the health and humanitarian response today? What are the biggest needs, and what can the international community do to be most helpful at this time?
Speaking about main gaps, so I would say that there are a lot of, for example, the most significant gaps are in long-term support. As I mentioned, also we discussed mental health services. It's not one consultation. It's long term. Also system strengthening and also workforce support. We touched a little bit this, but can you imagine that majority of, for example, health providers are women in Ukraine? And they have children. These children do not go to schools because of attacks. And some schools in central part, in west of Ukraine, have bomb shelters. But those who are in Odessa, Mykolaiv, Dnipro, Kherson, there are some schools only with bomb shelters, and majority of schools, majority of educational services are provided still online. So children stay at homes, mothers are in hospitals, also face all these traumas every day. And this is why workforce support and also mental health support for professionals, it's very important. And there is also gap in ensuring access to services in hard to reach and frontline areas. Still, Ukraine is very different and very big country. And in East and South, there are a lot of towns, different villages, rural communities with no access, and only mobile teams can be a solution, or some digital solutions or remote services, telemedicine can be helpful. So these are like main gaps.
Svetlana, we talked a little bit about the needs of children and women. Can you talk briefly about the elderly, the aging population? It's an extraordinarily vulnerable part of our society. How are they facing the cold weather, the lack of medical services, the constant rocket attacks? What impact is it having on the most vulnerable, the elderly in our society?
We have a lot of very old people in Ukraine now, much more than younger generation. And we have a very big demographic problem in Ukraine because very very small percent of newborn and a very big percent of retired person. All of them suffering from different chronic pathology and need some medication for this pathology. And a lot of medicine is very expensive. Unfortunately, our old person get very teeny, not salary. I don't remember the real name of this money from. As pension. Pension is it's really very small, and medicine it's very expensive, and our old people really need support and humanitarian medicine for treatment of chronic pathology. And I have very good relation with Institute of Obstetric Gynecology and Pediatric. It's big, very big hospital for 500 beds for small kids and women. And now they have a leak of patient because women in biggest part of women replace in safe territory, for example, in Uzhgorod or European countries, together with kids, and no one newborns, and this very big hospital stay particularly empty. And if you go in the shelter in the nighttime, you can see a lot of kids in the shelter. They should spend whole night in the shelter and sleep on the floor. And after that, they have a lot of problems with mental health. I think these kids are really not psychiatrical support, yes, of course, but I think they need time without air alarms. They need a real rest. For example, in foreign countries, when I was much younger, we had a Chernobyl catastrophe, and I remember we went together with kids. Was born in 1986 in Hungary, and spent 1 month in a normal territory without Chernobyl pollutions. And health of these kids improved dramatically very fast. And I think it's organization, some camp for our kids, some rest for kids and mothers. It will be very useful and bring a lot of normalization of psychiatric situation.
Thank you. Before we wrap up, Danielle, do you have any final words you want to share from the incredible perch you sit on working with so many people in crisis around the world and bringing that to the Ukrainian situation?
Well, it's Afia's honor to support the work of these three remarkable women in Ukraine. And I think what we see here, and I'm just going to say it again because I think it's really relevant, action is the antidote to trauma for all of us. So I think Afia is a welcoming, strong place to come to and to offer your hand so that we can all have an impact on the tens of thousands of lives who they are touching, but we can do this together and continue this thread of a response. And it's not changing. And I think these needs are just growing with time. And we've heard these stories, and there's something everyone can do to remain engaged and supportive of the people who are resilient beyond words.
Well, I just want to say a special thank you to Dr. Svetlana, Dr. Olga, to Alina, to Danielle. It's really important that more and more people understand and are educated about the critical work you're doing. To all the participants on this call, please take this message and spread it widely. Talk to friends, talk to colleagues, talk to family, Let them know that even though the Ukrainian story is no longer on the front page of our newspapers, as other global crises take prominence in the media, the needs and the issues and the crisis is maybe more serious today than it was 2 or 3 or 4 years ago. And we should continue to be supportive, to be engaged, to learn, to educate, and mostly to be thankful for the real heroines on the front lines doing the kind of life-saving work that all of you are doing. So stay safe, stay healthy, continue to serve your country people, and thank you once again for all that you do.
Thank you.
Thank you too.
Thank you.